Assalamu alaikum. So in this video we are going to discuss about papillary thyroid carcinoma. After listening the name papillary thyroid carcinoma, what comes in your mind? It must come in your mind that papillary means papilla, something like papilla. So first of all, I would tell you that four or five at least features that you must know about papillary thyroid carcinoma so that you can easily, and I am sure that you will inshallah identify that slide. Okay, so first of all, papillary means that cells here are arranged in papilla like this. Now, what is papilla? Papilla is somewhat like this, like this. This is papilla. Here you can easily appreciate papilla. That cells are arranged in the form of papillas. This papilla, this is another papilla. So, first feature is that cells are arranged in papilla. Next, cells are arranged around this papilla in only a single layer. There are no multiple layers or stratified layers like this here cell. There is only a single layer of cells, there is only a single layer of cells, there is only a single layer of cells, a single layer and a single layer of cells around these papilla. Now come towards somewhat smaller level. You must know about some cellular features. Number one feature is that cells here have orphan ani nuclei or ground glass nuclei. What is this orphan ani nuclei? Actually, nuclei in papillary thyroid carcinoma have finely dispersed chromatin, which imparts an optically clear or empty appearance to this nucleus, giving rise to the designation ground glass or orphan ani nuclei. Let me show you here an orphan ani nuclei like this. I hope so that you can easily appreciate here some clear cells or ground glass cells like these. Okay, actually there is no dark colored cells, I must say, so that you can easily appreciate, or I must say in language, layman language, that these cells are just ground glass, or there is no dark color inside the cells like this these. Okay, so these are orphan any nuclear ground glass nuclei. And then number two feature of the cells is that they have intranuclear inclusions or pseudo inclusions or intranuclear grooves. You know what is bean? Bean is just like this. I will show you later in the next slide a bean. So here cells also have intranuclear inclusions or pseudo inclusions. What are these intranuclear inclusions? Invaginations of the cytoplasm give rise to the appearance of intranuclear inclusions like this here, here, here. Almost all the cells have intranuclear inclusions. Actually, here, okay, intranuclear inclusions are just like this. There's a groove or inclusion around the cell. You can easily appreciate. Okay, and our third feature is semoma bodies. You know what is semoma body? Semoma body is actually concentrically arranged calcifications, concentrically arranged calcified structures like this. It cannot be easily so much easily appreciated in this slide, but these are these are semoma bodies. Okay, uh, it is also a pathognomic feature of papillary thyroid carcinoma. Actually, I'm telling all the pathognomic features of the papillary thyroid carcinoma, like ground glass appearance, like semoma bodies, like pseudo inclusions, all can be seen here. Okay, so these were some things that you must know to identify a slide of the papillary thyroid carcinoma. Now let's move forward. Here you can also see ground glass cells. Okay, next here you can also see papilla, papilla, papillary structures here, papilla, and clear ground glass cells can also be easily appreciated here. Next, you can take screenshot of the slide that in papillary thyroid carcinoma, there are some papillary formations. It means papilla-like structures like this, and semoma bodies I have shown you before, pseudo inclusions like this. You can easily appreciate here, and central clearing or ground glass cells. And what is this? Crowded overlapping of the nuclei. Sometimes you can also see it. You can easily appreciate here. Let me go back. That not all the cells here are arranged in the form of papilla. These are papilla, I know. All of these are, most of them are papilla. But here some cells are also just like crowded. Crowded appearance of cells can also be seen. Overlapping of cells in some areas can also be seen here. Okay. This one. Okay, so now you can see that here is a bean. I have told you before, bean. Okay, now you can also take screenshot of this slide if you want to know the neoplasms with nuclear grooves, papillary tumors, ovarian tumors, bone and soft tissue tumors, and many others. Follicular variant of papillary carcinoma. Now, what is this? Follicular means that cells are arranged in the form of follicles, but like this, cells are arranged in this is a follicle, and cells are arranged around it in the form of follicle. But all of these cells have features of papillary carcinoma. What are the features of papillary carcinoma? I have told you before, but or we can say that I have explained it many more before, like intranuclear influence, ground glass appearance of the cells. Okay, so next, you can also take screenshot as it is many times asked in your previous exams that what are papillary thyroid carcinoma variants? Tall cell oncocytic diffuse sclerosing variant, follicular variant, columnar cell variant. I think so that names are enough for you people. Then you can also take screenshot of this slide. Key histological findings. Number one is papillary architecture. Number two is semomo bodies. As I have shown you in first slide, something dark like structures. These were concentrically arranged calcified structures. Next, nuclear overlap. I have also shown it to you. Nuclear grooves. We have done with it. And then papillary carcinoma. Uh, I don't know. Yes, ground glass nuclei. Okay. Okay, so thank you so much. This was all about papillary thyroid carcinoma.